Thank you for joining us here today. I'm the Senior Associate Dean for Faculty Development and Diversity at Stanford, and I've been a faculty member here and a medical student here, by the way. So I've worked at this institution for quite a number of years. I'd like to talk a little bit about, following up on that wonderful personal story, why is diversity important in medical education? And I think you heard something about what that means. But let's talk about what do we mean when we say diversity. And here you see an iceberg, right? And the tip of the iceberg, when we think about diversity, we think about gender, race, and ethnicity, maybe a few other things. But what you see here is that diversity is multidimensional. Some diversity traits are obvious. When you see a woman, you can see that there is diversity there. You can see race and ethnicity at times. But there are many, many aspects of diversity that we see, that we don't see, and yet they contribute to diversity of thought. And I'll come back to why that's important. Now, there is an evolution to how we think about organizational diversity. That is, how do we get to that? And this is particularly important for our students because we want to be sure that we're bringing the right message to the next generation so that they can feel included and inclusive at the same time. As they move forward. And so this is what we call the diversity operating system. And this didn't come from the Silicon Valley. It does sound like it, but it came from Dr. Mark Neve, who was at the American Association of Medical Colleges a few years ago. And we've gone from DOS 1.0 to DOS 3.0, and I'll talk a little bit about what that means. So DOS 1.0 was the original altruistic. Diversity is an end in itself. It's important. We need to be inclusive of people because it's good for those people. But it's not critical to the primary institutional structure. And that was helpful. That was probably in my generation of students. And in some ways you felt that people were giving you a way in, but maybe you might not have been good enough. And that, has some effects. I think you've heard a little bit about how that can affect your perception of your work and how that actually can affect the work that you do. So then we came to DOS 2.0, or Diversity 2.0, and that is diversity as an educational additive. And by that I mean it enhances the educational environment for others, so for the non-diverse people. Although if you look at our iceberg, pretty much everyone can share some aspects of diversity. And so teaching diversity enhances competency for all students in terms of intellectual development, service orientation, self-awareness, and also, of course, cultural competency. But again, not integrated into the whole academic system. Now, what about DOS 3.0? This is where we think we are now, and I'm sure, as we do with other operating systems, we will hopefully keep moving to more enhanced DOSes as we go forward. This is diversity as a vehicle to excellence, and I want to emphasize that excellence. People who are diverse are as excellent as people who are not diverse. Because if we look at biodiversity, we look at multidimensional aspects, and we will find excellence if we look for it. Sometimes we do have to look harder because there is a longer distance for some people to travel than others. So diversity linked with inclusion builds innovation and high-performing organizations. And there is more data in the social media, in the social literature around the value of diversity in building programs. We also see that, for example, in businesses where they're starting to look at the value of diversity of thought. It is linked to a strategic imperative. That is, it's part of the structure of the institution. And inclusion is important as well. So having diversity without inclusion is a balkanization. So then you silo people. And what we want to do is what's called intersectionality. It's not a new term, but we are starting to see it more in this era. And that really means that when you look at the multidimensional aspects of diversity, you can intersect with other groups to help find common ground. And that's critical. And more importantly, from the realm of medical education, we need to know that faculty and academic leaders are key to achieving Diversity 3.0. So for example, in my office, as part of the whole academic mission of the School of Medicine, and my office, OFDD, is the Office of Faculty Development and Diversity. And we talk about excellence that's created through a diverse and inclusive faculty community because I deal with faculty. We also have a diversity cabinet that spans the whole realm of the School of Medicine, including trainees at all levels. And we're hoping to move forward and do the same for staff. And so one of the things that we have done is created these 4 pillars, which are inclusion, engagement, empowerment, and awareness, but they are all integrated into the School of Medicine mission. And this is an ongoing aspirational goal. We hope to build on this mission and these pillars to make them stronger. So there's the other imperative. The other imperative is the diversity population imperative. We are caregivers. Our medical education trainees are going to be caregivers, and they are caregivers in some instances now. So who are they caring for? They are caring for a very diverse population, as you probably know. So in this slide, you can see the diversity of the national patient population, minority population projections from 2012 to 2060. So you can see by next year, the minority population is projected to become the numerical majority of the population in children under 18 in the United States. And by 2043, the entire country will be there will be no majority population. So we have a very diverse culture. And you see what happens when we are fearful of that population, when we don't embrace it. We need to, again, remember how much we have in common. And part of that is dealing with patients and patients dealing with us who come from various backgrounds. Now, the data from California are equally diverse. So you can see here, California 2013 and Santa Clara County 2013, for those of you who are from the Bay Area. And you can see that the majority of the population in all of the different pie charts here are very diverse. And actually, there is no one majority population in California or in Santa Clara County. So these are people who feel much better dealing with those who are culturally aware of their differences. We put people in stressful situations when they know that their health is at risk, and they feel better, they do better, and they tend to be better at following up on their medical advice when they feel that their caregiver is culturally competent. So this is another imperative around inclusion and diversity. So what about the importance of diverse teams? How do we approach this? And again, this is more information around the evidence base for how diversity can work. And I have to say, this is an area of ongoing research. It's really something that happens in the behavioral sciences. So I'm just going to talk a little bit about how we work. So we all know the concept of unconscious bias, right? So we all naturally, just like the fight or flight response that we're all built with, we have an unconscious bias. We sometimes make very quick decisions. In fact, all day long are a series of very quick micro decisions that we make. And those are based on automatic tendencies that we have. So for example, past experiences, validation, that is a particular name of a university, a particular research area, a place you've been to, a restaurant that you've gone to that you had a good experience with. You have these automatic tendencies. It's easier, faster, and we know that we trust ourselves in these particular spheres. We also have social ties, friendships with advisors, with colleagues, with friends, and we will use those also. Well, that person is a wonderful, they have great judgment. I should really listen to that person. And this impacts organizational structure at every single level. At the level of incoming students and trainees, who do we pick? Who do we enroll? Who do we bring into our research teams? As students, as postdocs, as faculty? How do we hire new faculty and staff? And even though we have valid quantitative metrics, those are not, our inherent tendencies will sometimes flavor those. And I would say they flavor those almost all the time. And we need to just be aware of those so that we can try to be a little more objective, take a step back and say, are we really looking at this person in as objective a way as possible? So Having said that, the biggest predictor of team success by metrics that have been put together by organizations such as Deloitte, such as Stanford University and other universities, looks at metrics such as financial success, degree of innovation, productivity. The predictors are diversity of expertise at the table. So diversity of thought, diversity of experience, diversity of background, and diversity of approach. And that makes a lot of sense. But when we think about diversity from the broad sense, racial, ethnic, gender, those are the basic diverse areas. Those are also very critical because people bring different experiences to the table that may not have been heard before. And in particular, from the business standpoint, you're looking at people who are going to be end users of a product. So you want to hear that unique experience. So what's the difference between homogeneous and heterogeneous teams? Well, homogeneous teams have less information available, almost, I think the new term now is echo chamber. We hear the same thing and we validate our own opinions over and over. So therefore, less capacity to learn because you have uniform views and agreement. And I wouldn't say, this is an absolute, but obviously it would be, it's not that it's completely homogeneous, but there tends to be more agreement. And then lack of unique perspectives can lead to the illusion of rightness. Well, we all agree, so this must be the right thing to do. Heterogeneous groups, on the other hand, bring distinct backgrounds to the table. At Stanford, in admissions, we call it distance traveled. For example, how far did that person have to get to this point? Some people had to travel a longer distance or a more circuitous distance, and in so doing, may have brought new experiences to the table. These include demographic, educational, and cultural experiences. And they bring these diverse opinions and points of view to the table. So that's the good news. Now here's what's interesting about recognizing the importance of diverse teams is that you also may have some inherent tensions in the team. And by that I don't mean personal tension, I just mean tension of interaction and of synthesizing an idea. So in this slide you can see that on the left, you can see group accuracy. So socially similar teams are significantly less likely to consider themselves to have group accuracy. That is really addressing the point that is at the table than socially dissimilar groups. Because they tend to question one another and then they circle around and they eventually come back to answer the question that's at hand. People are more likely to say, that's actually not where we were going. We're going into this direction. And so they tend to self-correct a little more. But interestingly, a confidence in accuracy and perceived group effectiveness are less for socially dissimilar groups. Because of that inherent tension at the table, new ideas, ideas that maybe not everybody has heard, people tend not to feel as comfortable with the final result. But when you bring it up to a higher level in the structure of the organization, you find that those ideas are actually much more innovative and much more accurate in moving the goal forward. So this is the inherent tension of having diversity. And I think that the question will be, as we become more diverse and inclusive, does this tension tend to ease a bit? And do we learn how to harness that tension and really use it to move our groups forward? So what about inclusion? We've talked really about diversity, but if we have diversity without inclusion, then we wind up with silos, and we really don't want to do that. And so there are a number of studies now looking at the issue of inclusion, and again, the issue of intersectionality. So for example, when we look at women's issues, and then you see women of color saying, well, we want our white women sisters to come back and say, and support our cause, just like we support the overall cause of gender. This is what we mean by inclusion. Let's think about the common ground that we have. And in medical education, that can be important as well, because as you saw earlier, and as you probably know as educators yourselves, medical education is a tough thing to do. You're working hard. You know, it's a prime field for mistakes and errors and fear and fatigue, et cetera. So in those areas, you are much more vulnerable if you feel isolated. And so we have seen a number of studies now going from college level and above to now children in primary school, that when you actually increase the sense of belonging and reduce the stereotype threat. And I'll come back and talk about that. It is the tendency for people to feel like they are being judged for whatever their diverse background might be. Whether that's true or not, the feeling that you are going to be judged is kind of a self-fulfilling prophecy. But if you do try to increase that sense of belonging, you not only improve the individual performance of the person who was primed to feel that they belonged more, but you actually affected the performance of the entire classroom. And this has been shown children as young as kindergarten and first grade. So it works really well, and it's a subtle thing. You can do something that's very subtle. You can make children cue them, and you don't say, you're actually a wonderful person and we're doing it, we're going to make you the inclusion person. It's much more subtle than that. You give them a little bit of praise and just validate them. We're so glad you're here. You're doing such a great job. You seem to be good at X, Y, and Z. And that little bit of support brings more confidence to that person. They feel much more included. And it does, in fact, when you do that compared to control groups, it does bring those children, their performance goes up, and it really also infuses or diffuses that sense of confidence to the other group. So we know that inclusion is better for our trainees, and we know that that inclusion also can then lead to ability to improve the diversity effect on in performance and excellence. So, and I'm going to end with this and say that diversity and inclusion are vehicles for excellence in medicine. The diversity perspective comes at many levels, at the departments, at the School of Medicine level, at the level of healthcare systems all the way across, and finally around the areas of community diversity. And we think those are important, and we need to really focus at every single level on how do we maintain that approach when we deal with our trainees and our communities. And so I will stop there and thank you for your attention.